Hi, this is Dr. Bharadwaz, Chief Doctor at Fidicus Homeopathy. Today we are going to discuss on the topic of benign prostatic hypertrophy. We call it as a prostate enlargement. So basically you are afraid that this problem do not have a permanent cure and this problem may lead to cancer in future, and also you are afraid that your sexual desire will be damaged or you will not have sexual desire as the disease progresses. You are forced to take the medication even though you know that these medicines do not give permanent cure, or these medicines has a lot of side effects and you have to depend on the medicines for lifelong, even though you know that you are forced to take these medicines. Basically, what is prostate enlargement? Prostate is a gland which is located inside the pelvis just below the urinary bladder, and this enlarges after the age of 50 years in males. Prostate is very small at birth and it's going to reach its maximum size when you are 25, and after that it continues to grow. It will be stable from 25 years to 50 years. After 50 years it again starts to grow. There is two type of growth. When the gland grows outside, then you will not have a problem. When the gland grows inside, then you will have the problem where it obstructs your urinary passage, and all the problems are caused due to this. What are the signs and symptoms of prostate enlargement? The first symptom is polyuria. So you have to urinate again and again. You have to go for urine with high frequency. And also there is nocturia. Nocturia means you will be waking up at night or passing urine multiple times. And also urgency. When you have the urge to urinate, so you cannot control it, you always have the urgency to go and urinate. Incontinence. Incontinence in the sense, once you get the urge to urinate, you cannot control your bladder. You have to run to washroom and urinate as early as possible. And slow stream. While you are passing the urine, the stream of urine is very slow. There is no force in it. And also hesitancy. Hesitancy in the sense, so when you go to washroom and try to urinate, it will take some time for you to urinate. The urine will not come once you start urinating. It will take some time. And also terminal dribbling. So once the flow is completed, always there is a dribbling of drops or dribbling of urine, involuntary dribbling of coming out of urine from your urethra at the end of urination. And also you have the sensation that the urine is not voided completely. There is still some amount of urine left over in the bladder. So you have this sensation. Hematuria. Hematuria in the sense, sometimes you may find blood while urinating. Retention. Sometimes what happens is, even though the urine get retained, the urine will not come out of the bladder because of the obstruction. It may lead to renal failure where there is high amount of pressure in the bladder and it may damage the kidneys and you may go into renal failure. And also when you have renal failure, you have the symptoms like edema on the face or puffiness of the face and edema of all over the body as well. What are the major investigations you have to do for prostate problem? First one is you have to check complete urine, CUE, complete urine examination, and also you have to do kidney function test, how kidneys are functioning, and all the sugar tests you have to do: fasting blood sugar, postprandial blood sugar, random blood sugar. You have to do all these tests, and also USG abdomen, ultrasound abdomen is very important. It gives direct radiological information about the prostate gland. And also uroflowmetry. Uroflowmetry is very important in this case. Uroflowmetry gives the amount of urine that is coming out of your bladder per minute. So at what rate the urine is coming out, is it more, is it less? Based on that we can decide the health of the bladder. One more test is PSA, prostate specific antigen. This antigen is specially for cancer. If you want to rule out the prostate cancer, you have to do this test. It is very important for prostate problem patients to understand anatomy of the bladder, kidneys, and also prostate and urethra, because these are all mechanical structures, right? There is a mechanical obstruction, so you have to know much about that so that you can have better understanding about your disease. So basically prostate is a walnut shaped gland. It is located just below the urinary bladder within the pelvis. The important structure that passes through the middle of the gland is urethra, where your urine is coming out. The pipe from which the bladder is communicating to external through this urethra. So this is a small pipe. It is a straw-like structure which is coming out from urethra, and this causes the urine to come out of the bladder. This first part of this tube, we call it as prostate urethra. In the place of prostate urethra, prostate is surrounding this urethra, or the urethra is passing through this gland, so that any damage to the gland or any inflammation in the gland or any pathology in the gland is going to obstruct the urinary passage. And also you have to know there are two kidneys on left and right side. From kidneys, the urine is collected and it goes into two tubes, that is ureters. From ureters, that urine reaches the bladder. From bladder, the urine is stored in the bladder, and after some time, when the bladder is full, you are forced to urinate through the urethra. And one more important structure you have to remember in the bladder is a muscular organ. So these muscles will contract so that your urine is pushed out from the urethra. So this is very important structure you have to understand, because the further pathology is going to depend on this. So, and coming to physiology, hypothalamus senses the amount of testosterone in the blood, and it releases luteinizing hormone releasing hormone. This luteinizing hormone releasing hormone from hypothalamus reaches the anterior pituitary through hypothalamo pituitary portal system. Once this luteinizing hormone releasing hormone reaches the anterior pituitary releases luteinizing hormone. This luteinizing hormone go and acts on testis and adrenal cortex, and this produces testosterone. This testosterone is converted into dihydrotestosterone with the help of 5-alpha reductase enzyme. This enzyme is present in prostate gland. So the enzyme 5-alpha reductase, which is present in prostate gland, converts testosterone into dihydrotestosterone, and this dihydrotestosterone is much powerful than regular testosterone. So, and this causes the prostate gland to enlarge. Okay, this is very important for you to remember. So this dihydrotestosterone, which is present in prostate gland, converts testosterone into dihydrotestosterone, and this dihydrotestosterone is responsible for enlargement of the prostate gland. And coming to the functions of the prostate gland, so why do we need prostate gland in our body? What is the importance of prostate gland? So basically, prostate gland secretes some fluids. This fluids is mixed with seminal fluid. And see, normally the secretions in vagina or the secretions which are coming from the testis are acidic in nature. So these sperms cannot survive in acidic environment. For the sperms to survive, there should be some buffer, and it should be alkaline. This alkaline environment is provided to the sperms against the acidic environment in female vagina and in the testicular secretions of a man. So this fluid or this seminal fluid is responsible for maintaining alkalinity, and this ensures that the sperms are motile. And also it helps in the clotting of the sperm. Once the semen is deposited in female vagina, this prostatic fluid helps for the sperms to attach itself to the cervix. After some time, once they are attached to the cervix, after some time the clot get dissolves and the sperms become free swimming, and they swim towards the fallopian tubules for fertilization, and this helps in lysis of this clot. And also this prostatic fluid contains enzymes, nutrients, hormones, and all the chemicals required for the sperm to survive and ensure that it has good fertilization capacity. Coming to the etiology, so what is the cause for prostatic enlargement? The only cause that is found for prostatic enlargement is due to familial history, or it may be in your genetic. This is a genetic disorder. Mostly if your relatives, or if your blood relatives, father side or mother side, siblings or uncle or any of your blood relatives have this prostate hypertrophy, you are more prone to get this disease as well. And coming to the pathology, what happens to your body when you have prostate problem? So after the age of 50, the conversion of testosterone into dihydrotestosterone with the help of 5-alpha reductase, which is present in thyroid gland, will increase. So this is an enzyme, 5-alpha reductase is an enzyme. This converts testosterone to dihydrotestosterone, and this dihydrotestosterone is responsible for enlargement of the prostate gland. The production of dihydrotestosterone increases in the male when he reaches 50 years of age. After the 50 years of age, this production increases. That's the reason your prostate get enlarged. And what kind of hyperplasia it is, or what kind of a disease it is? See, this is a nodular hyperplasia, means there will be small nodes. So node like structure means small hard structures within the prostate gland. There will be some round nodular structures. This is a nodular hypertrophy. So this causes, so when the gland enlarges, so urethra is passing through the middle of the gland. This gland compresses the urethra. Once the urethra is compressed, then you will have difficulty in voiding the urine. All the problems which we see in prostatic hypertrophy or due to compressing of this urethra, that is prostatic part of urethra. And coming to the conventional treatment in the sense the treatment which the doctor is going to give when you go to a corporate hospital or you go to a urologist or any doctor nearby you. This is the treatment he is going to advise, that we call as allopathic treatment or conventional treatment. This conventional treatment is mostly they will give medicines so that to block the DHA and further progress of the disease. And also they have only surgical options in the sense they will insert a tube into urethra and they will destroy this prostate gland either through inducing the electricity or cutting the gland through laser. These are the main options they have, and also they can completely open the pelvis, surgically remove the prostate gland. So these are all the options. These are all painful and also they have a lot of side effects. These are all the disadvantages we have for conventional treatment. And the conventional treatment, there is no medicines to prevent the progress of this hypertrophy, and also there is no medicines to reverse this pathology, reverse the enlargement of prostate gland, and also they will just give the palliation. This palliation is also contains lot of side effects. And let's check how homeopathy can help in this regard. In homeopathy we use constitutional treatment. See, you are getting this, any disease you get is because of two reasons. Some part of the disease is coming from genetics and some part of the disease you are acquiring from outside. Acquiring from outside means it may be due to your food habits or exercise habits, sleep habits, or stress in life. So the combination of internal problems and external problems is your constitution. This constitution is expressed in three forms in you. So because of this, you will have some changes in the mental picture. You have some changes in the physiology of the body, function of the body, and also you have some changes in the structure of the body. Here, structure means the prostate is enlarged. Nodules are formed in the prostate. Function means the DTH levels is increased in the body. This is all functional, and also because of this we will have depression, we will have suicidal tendencies, all this. So by considering all these three things, so we will prescribe a constitutional remedy in homeopathy. What this remedy does is this produces a hormetic response. This induces a small stress in your body so that your body reacts against the stress and it will completely cure the prostate enlargement. So in early stages there is high chance that your prostate enlargement is completely recovered, but in later stages it gives palliative treatment without any side effects. So we can control it, we can control the gland from going into cancerous tissue or enlarging further, but in early stages this prostatic enlargement can be completely reversed. Apart from constitutional treatment, we also give local treatment. Local treatment is based on pathology. So where the nodules are present, or they are present in left lobe, right lobe, anterior lobe, posterior lobe. Based on this, we prescribe medication. And also how the urine is retained. So what is the sensation you have? Do you have any blood in urine? We consider all these and give local medicines as well. So homeopathy can prevent the further occurrence once you get treated. So it will prevent you from enlarging the gland again, or in early stages once it is cured, it prevents from occurring again and again. And also in early stages it has the capacity to cure completely. When it is in the final stages or your disease has been for a very long time, when we are not able to completely cure the disease, we give palliative treatment, and all the symptoms are reduced, but you still have the pathology. All the symptoms are reduced, but all these are without side effects. So allopathy has side effects, only homeopathy doesn't have any side effects. So why homeopathy is safe in this case means why homeopathy medicines do not have side effects. Homeopathy medicines do not have side effects because of two reasons. First one is in homeopathy we use nanoparticles. This is advanced way of making medicines. So we use nanoparticles. The nanoparticles in the center contains an active ingredient. Surrounding that we have lactose coat. On top of it we have silicon coat. This is a nanoparticle. When these nanoparticles are introduced into your body, they go and hit the target. So wherever the medicine has to work, it will go and hit only that. There is no off targeting. So if the disease is here and these medicines are not going to work at some other place, when the medicines are going to work at some other place, then only you will have side effects. As there is no off targeting in homeopathy, you will not have any side effect. And one more reason why you don't have side effects in homeopathy is, see, you take Ayurveda or allopathy or any other system of medicine, there you give medicines in grams and milligrams, but in homeopathy we use only small quantity, that is in picograms. few hundred to few thousand picograms will be introduced into your body. As this medication is so low, that's the reason we will not have side effects. And why homeopathy is so effective? It is effective compared to any other treatment. You have the best treatment in homeopathy to prevent your disease, to cure your disease, to palliate your disease, than compared to any other system of medicine. The reason is homeopathy works on the principle of hormesis. Hormesis principle says any substance in the world, you take water, even water in higher quantities can kill a person. But in lower quantities, even snake venom, when you take snake venom in lower quantities, it acts like an excellent medicine. In the same way, these nanoparticles elicit a hormetic response. So it induces a small stress in your body, and because of the stress, your body reacts against the stress so that your disease is cured. This is hormesis principle. The homeopathic medicines works on the hormesis principle. It is so effective. And why homeopathic treatment is very affordable compared to any other treatment? So for example, you take allopathy. There we have the concept of patent rights. In allopathy, if any pharmaceutical company finds a new drug and they will be given exclusive rights to prepare the drug, no other pharma company can prepare it, and they can sell for the price they desire. There is no competition, so they will sell it for high price. There is no competition among the different companies, as this company only going to prepare this medicine as per government instruction. But in homeopathy, you don't have patent rights. Any medicine prepared by any individual or any pharmaceutical companies can be prepared by other pharmaceutical companies as well. That's the reason there will be a lot of competition and the price of the medicine is reduced. This is the main reason where the homeopathic treatment is very cost effective, as there is no monopoly over the medicines for homeopathic treatment. What are the precautions you have to take in case of prostatic hypertrophy? The first one is restrict taking fluids when you are going to bed. At least for 3 to 4 hours before going to bed, you should stop taking fluid, so that you will not have any sleep disturbances, or you will not be waking up in the middle of the sleep for voiding urine. So, and do not hold the urine for a very long time. So if you hold the urine for a very long time, your bladder muscle get damaged and hypertrophy in the bladder muscle. This causes permanent urine retention. That is the reason you should not be holding urine for a long time, and you should be voiding as early as possible. Do not use antihistamines. Antihistamines causes narrowing of urethra, so you will have more retention symptom. Antihistamines you will be using for common cold or allergies or asthma. So don't use these kind of medicines when you have prostatic enlargement. And also with cold exposure, when you are exposed to cold, what happens is there will be pooling or there will be congestion of blood inside the organ. So what happens is when there is congestion inside the prostate gland, so the prostatic urethra will be narrowed and it will be compressed due to flow of blood. That is, these are the important things you have to take care. And coming to other things, take healthy diet, take low carbohydrate diet, take good amount of proteins, good amount of medium amount of fats. You have to take food with this high in fiber, rich in minerals and rich in vitamins, and also take adequate amount of water. So take a lot of probiotics, and take organic foods, plenty of fresh fruits you can take unprocessed foods. So less frequent intervals of food is recommended, and also you can do fasting sometime. So fasting is very good. And also do not take GMOs, genetically modified organisms, or artificial sweeteners or artificial colors. So don't take all these food. Reduce the amount of cereals and millets because these contain high carbohydrate. Take plenty of pulses, pulses in the sense sprouts. You can take plenty of vegetables, seeds you can take, nuts you can take. Reduce the fruits when you are above 50 35 years of age. You can take meat, you can take eggs, spices, and also fats and oils. You reduce the saturated fats in the sense those are present in animals. Other than fish, you can take plenty of fish has no problem, but fat of other animals. And also don't go with refined oils, always use cold press oils, and ensure that you have 7 to 9 hours of sleep, so that every organ, especially prostatic hypertrophy, will also be in control, and your hormones will be in our control when you have 7 to 9 hours of good sleep. And also do good amount of exercise. You can do zone 2, zone 3, and zone 4 cardiac exercises. You can do strengthening exercises, power exercises, speed exercises, endurance exercises, both short duration endurance, mid duration endurance, long duration endurance. You can do all these kinds of exercises. And coming to lifestyle, try to be as stress free as possible. So live in a pollution free area, and also live very close to nature. And coming to the prognosis, what happens when you neglect prostatic hypertrophy? The prostatic hypertrophy and the cancer of prostate are very close, and they also have similar symptoms. So do not neglect this prostatic hypertrophy. You may lead into cancer. And also, if you don't take treatment for prostatic hypertrophy, what happens is there is lot of clogging of urine or retention of urine when you hold the urine for a long time. So there will be a small muscle in bladder. So this muscle enlarges, and this muscle loses its function, and you are not able to contract the bladder. Because of this, we will have urinary incontinence. When the bladder is full, there is no control, and urine comes out involuntarily. And also, when there is retention of urine, this retention of urine may cause infection in the bladder or formation of stones in the bladder, and this pressure increases. This pressure will put back pressure in kidneys. Because of this, kidneys will have inflammation. You will land into chronic kidney failure and also nephritis. These are all the kidney problems. You can also land into kidney stones. And also, one more problem you face is initially there will be transient increase in your sexual drive. Your sexual drive increases, but over a period of time, you become impotent. So there is no sexual drive, there is no erection. So there will be a lot of sexual problems if you neglect this disease. And don't worry about this disease. We are physically located in Manikonda, Hyderabad, but we can take the cases all over the world. We have prostate patients all over the world, so we can take online consultation. Your online consultation can be done in voice or in video, and you can share your reports or any other material to us, and also we will ship the medication to your doorsteps wherever you are in this world within couple of days. So make use of it. Within India, we can ship within 2 days, but any part in the world we can ship within 1 week. So make use of this opportunity. So reach out to us if you have any prostate problems, and do not hesitate to take homeopathic medication for prostatic problems, because it is highly effective. We can cure your disease, prevent your disease, palliate your disease without any side effects, with affordable cost. Thank you.